Could we then move on to the next agenda item, the North Powys Wellbeing Programme and the programme business case. Hayley, this is yours again, I think.
Diolch Cadeirydd. Rwyf yn falch o gyflwyno achos busnes raglen Llys Gogledd Powys. I am really pleased to present the programme business case for the North Powys Wellbeing Programme. On the next slide then, our long-term health and care strategy, A Healthy Caring Powys, sets out our vision and priorities and identified the need for 3 rural regional centres across Powys. This programme is a flagship programme for the Regional Partnership Board to implement the new integrated model of care in Powys and to do so in Newtown in the north of the county. The Health Board, alongside Powys County Council and Regional Partnership Board partners, approved the integrated model of care presented in this slide earlier this year. In order to enable residents in Powys to live longer, healthier and happier lives, there's a need to shift our focus towards a model of health and care away from service delivery in acute and specialised hospital settings and offering a more integrated model with more wellbeing, early help, prevention and support delivered closer to people's homes and communities. And we've plans to enable health, social care and other partners to work together to help people live well in their communities, to meet their health and care needs effectively, and to make sure that we can provide as much care within Powys as possible and as safe to do so. The purpose of the programme on the next slide is set out. This is a long-term programme of change and it's very much in the space of partnership. And the programme business case is one part of the jigsaw in that it sets the case for a collaborative multi-agency wellbeing campus for the population of North Powys. The programme, which was established in 2019, was supported through Welsh Government transformation funding, and I believe it's a once-in-a-generation opportunity for us to bring together partner organisations to enhance and transform the way services are delivered to the local community. I think the programme business case demonstrates that ambition, and in particular it brings together partners across health and social care, but also education, housing, community and the third sector, with further opportunities to link and strengthen our model around leisure, police and the ambulance services. It will also maximise wellbeing and leisure opportunities because there are essential links with green spaces through Open Newtown and collaborative working with partners in the third sector and local business, and a strong focus on supporting the economic growth and regeneration of the area in line with the National Development Framework, which identified Newtown as an important regional centre, but it also has very strong links with the town centre, supporting Welsh Government sort of initiative called Town Centres First. On the next slide, I just thought I'd explain what a programme business case is. This is a first stage document and is a live document, is continuously updated as further more detailed work is undertaken. And its aim is to set out the strategic direction for the investment and the benefits that that would provide. So it is focused on securing capital investment, which is one of the key enablers to putting in place the full model of care. So this sets out our vision and our case, and we'll be sending this into Welsh Government to support the partnership to take forward the next stage of detailed development for the programme. We've followed the Welsh Government advice to develop the case, and it sets out the benefits of the scheme and also follows what is described as the 5-case model, which sets out the strategic, economic, financial and management arrangements proposed for the programme going forward. On the next slide, we're summarising the benefits that we're planning at a high level for the overarching scheme. And we believe we're presenting a really strong case to Welsh Government because this programme not only supports us to deliver our long-term strategy within Powys, there's also a strong tie-in to Welsh Government policy. particularly the contribution that we're making across the various areas I've mentioned before: education, housing, health, regeneration. But also we've had a strong focus on the Future Wellbeing and Future Generations Act, and about how we can build a sustainable model for care for future generations. And we've used the 5 ways of working enshrined in that Act to develop this programme. We've also taken a very strong view around how we should be designing and taking the programme forward, and it's very much based on co-production with key engagement with the public and interested stakeholders. And we have asked people what matters to them so that we're able to build the model on that basis. And that obviously, again, is a key principle enshrined in the Social Services and Wellbeing Act. So although this investment is focused on the capital investment aspect of this proposal for the campus, I just wanted to reassure the board that the overarching North Powys Wellbeing programme is supporting new ways of working to be implemented and for elements to be tested across the North Powys area. On the next slide, it sets out our emerging model for the multi-agency campus, and a core aim of the programme is to provide significantly improved and enhanced local services delivered from a single location within sustainable and fit-for-purpose accommodation. This approach will maximise efficiency, integration and potential for innovation across the sectors I've mentioned earlier, and I think it's a really exciting opportunity for us to develop a different way of working that fits the rural context in which we're working within. In the case, the next slide sets out, just reminds the board of why we chose North Powys and Newtown as the location for the campus. I think it's important that Newtown is the largest town in Powys, with a population base of over 11,000 people, and obviously North Powys has a larger population of around over 63,000. We know there are high levels of deprivation in relation to both health and economic indicators across pockets of North Powys, and Newtown is a strategically important location in strengthening health and care services for Mid Wales. And I think it's a really excellent opportunity as well to help us do more what we can within Powys to reduce the likely impact of health service changes happening around the borders. The other issue is the current buildings that we work from are of poor conditions and are dispersed. They're not in one location, so there's several buildings in Newtown that we use to provide care. Therefore, there is significant potential for further integration and innovative health and care to be delivered from a single site campus. The next slide sets out the preferred site that has been chosen for this development. It's been very significant technical work undertaken on this, which identified and appraised a range of options around the area, and this was by far the highest scoring option on a number of fronts. I think it's important that the park site, which is right in the town centre of Newtown, it's centrally located, it's near to the car park and transport links, and is a really important location to help ensure that people continue to come into the town centre and support the regeneration of the area. The other issue I'd like to mention is that obviously the park site is a significant parcel of land that is owned by the council, and the council obviously are very key in this development. And on that point, I should tell the board that the Cabinet met earlier this week to consider the programme business case. It went there first, obviously, because of the land ownership issue around the preferred site, the park site. And I'm really pleased to report that I was informed yesterday that the Cabinet has fully supported the content contained within the programme business case, and are very excited to submit this case through the Regional Partnership Board and with ourselves to Welsh Government for their consideration. The next slide sets out sort of an outline plan for the preferred site, and I'd like to, bit of a health warning on this one, it's indicative, there are no definite plans, we still are at the very early stages of this work, and things may move around a little bit. But what this did was demonstrate that the plans that we have for both education, health, social care, housing, community all fit onto the site. And it's really clear also that we've looked at high-level phasing of the plan and what would need to happen where, and particularly the school 21st Century Schools programme. There's been significant work undertaken with the relevant schools and the governors and the board of governors for the schools. The preferred location for the school can be accommodated on the site, as well as making sure that we can deliver what we required for the integrated campus. So this is just an example, just to reassure the board that the site is big enough to accommodate the maximum requirements that we would be looking for when we actually look at the detailed design. The next slide sets out the capital funding requirements for the multi-agency wellbeing campus and our approach to the business case management. So, as I said before, the programme business case outlines our plan to Welsh Government to get their approval for the vision and the range and scale of investment required to deliver the vision for the campus. We'll then deliver and develop a series of business cases for each element, but of course we'll ensure that the infrastructure requirements for the whole site, as well as the benefits of the whole site, are described in each of the cases, and we'll make sure that in so doing we'll have a strong focus on the sustainability and environment requirements as well. So we have considered the various options that we could have taken to develop this next stage of business case development, and we've taken this sort of phased approach because it minimises the risks for the whole campus in doing it this way, but also we've been in active discussions with Welsh Government around the approach, who are supportive around how we've developed the business case plan that sits underneath the programme business case, but also how we're planning to take forward the phasing of the works. Only a couple more slides to go, one more slide to go. I just wanted to give you an indication now of the high-level programme phasing plan. I think, again, I'm reiterating, the programme is in the still the early stages of development and design. So we have completed the feasibility, we've delivered an approved model of care, and that was based on detailed population needs assessment and significant engagement, as I've mentioned before. The service design work now will require us to continue to take the next stage of development, detailed design, and that will include the input of our workforce staff, clinical, professional, service user, public and stakeholder involvement. And again, reassuring the board that the detailed design of the facilities and the capital investment will be developed to respond to the requirements of the model and to serve the population of North Powys. So during this next stage of development as well, we'll also have to give attention, equal attention, to ensuring that the programme is underpinned by whole system change. So we are needing to test new ways of working and take forward proposals to accelerate our progress towards implementing the integrated model. And there's a very strong focus on workforce, new ways of working and organisational development support as well, in recognising that this partnership will be both innovative and different to how we perhaps work within our individual organisations. So we'll have to work strongly as a partnership on the organisational development agenda. So I'm really pleased to present the programme business today. It's a significant amount of work, and I'd like to thank all partners and particularly the team who've worked tirelessly to turn the vision of an integrated model of care into this programme business case presented today for the multi-agency collaborative campus. And I'm very happy to take any questions.
Thank you, Hayley. Could I ask Carol Shillerbeer to come in, comment then, please?
Yeah, thanks very much, Chair, and thanks to Hayley for that really comprehensive presentation. All I wanted to say really was, when we were developing the health and care strategy, which of course was the first integrated health and care strategy in Wales. We did that back in 2016 and 2017. We involved and heard the views of hundreds of people in our communities across Powys, and so this development is really in response to that. People talked about wanting joined up care. They wanted us to do as much as we could closer to home. They wanted us to focus on health and not just ill health. And so, you know, I hope that this directly speaks to the ambitions that communities had for themselves and for each other. I think this is a once in a generation opportunity for us to do something that is really truly integrated and focused on the well-being of future generations, and this development will really last through decades and beyond. There are some challenges. Clearly, we are now coming to the end of this political term, and the election for the Welsh Parliament will take place in May, as far as we're aware. And it is going to be really key to get this programme business case in front of ministers for sign-off. We know that the First Minister spoke on the floor of the Senedd back earlier this year, or maybe at the end of last year, with support. So we do now hope that that support can be translated into sign-off of our programme business case, because then we can really motor forward on to the next stage. So I'd like to reiterate my own thanks to everyone that's been involved in this work, whether they work for the Health Board, the local authority, whether they're members of the community and our other stakeholder groups. It's been a phenomenal piece of work, and I really do hope that the Welsh Government will feel able to back it and get behind it, and then we can move this forward with pace. So thanks very much, Chair, for enabling me just to say a few comments in that regard.
Thank you, and it is a really encouraging example of collaborative working. It's very, very encouraging. I can see that Melanie Davis would like to come in. Over to you, Mel.
Thank you, Chair. I would just like to congratulate Hayley and the team. I've been part of the scrutiny of the North Wales Programme Board since its inception, and our agreement to take this forward, which is obviously really exciting. My greatest regret is that I'm not going to be here because my term will have ended by the time we finish this, because it's such a key piece, I think, for Powys. I've always been quite excited by this. But I would just say that our overview and our scrutiny was enhanced the other day. We met on the 19th, and the North Powys Wellbeing Programme Board agreed that we actually needed to widen that base. So just for information for the other members, really, which we haven't touched on, there are now 4 of us on that from the Health Board, and 4 indeed from the board, from the Cabinet, I apologise, in the County Council as well. And that will give us a wider buy-in and understanding as this progresses into this stage now, so that we can have more assurance around that from a whole board position, because it's such a crucial, huge piece of work, isn't it? And so that understanding is critical. So I was just really wanting to draw that in for the board's attention, because it's just such a sort of healthy thing to do, to involve more people at this stage. So thank you.
Thank you, Mel. Susan Newport, you have a question, I believe.
Yes, thank you, Chair. Hayley, my question is, do you envisage the COVID-19 restrictions will affect the future development of this plan long term? I'm thinking here of the difficulties around public consultation, the difficulties we're facing in education and leisure facilities.
Yeah, it's a really important point you've raised, Susan. I think that with all of the developments that we're putting in place at the moment, we've referenced in the programme business case, this one and the next one, we're considering the need to learn from the current pandemic and how we need to respond in relation to that. Thankfully, because we're at that visioning stage with the programme business case, in the next stage of design, we'll be needing to revisit and do further work to understand what that broader impact is, both on education, health, housing, social care. it's interesting because from my perspective, we're building this for the future with very long term in mind. So we do need to make sure it's future proof from the point of view of responding to the pandemic, but we also need it to be fit for purpose after the pandemic, so that it's can be delivered. But yes, absolutely, part of this work, we've already started to take some learning around ventilation and certain other issues around the physical environment within the current work that we've put in place. But during the next stage, which will take us to the detailed design and the proposals and the space and exactly what goes in where and how we'll be running it, we'll be ensuring that that learning and that impact around the pandemic is considered front and centre. But that detailed work yet hasn't quite happened yet, thankfully, because we've got the time to actually take the learning into this programme of work.
Thank you very much for such a comprehensive answer. Thank you.
Thanks.
Thank you very much. Are there any other questions before we move to approve this? I'm delighted to note that the Cabinet has already fully supported this case. So can I ask you all then if you're willing to approve the draft programme business case ready for submission to Welsh Government at the end of October? Thank you.